Hello, everyone. I think we're going to go ahead and get started. Just wanted to welcome you all to our final session of Mini Med School for this year on blood pressure. We're very excited to have you all here. Right now, we have our feedback form up that we would love if you would fill out to help us to continue to improve this seminar series, as this is something we do every year. We'll put it up at the end also, and I'll email it out to all of you as well. So don't worry too much if you miss it. We're really excited to have a whole panel of experts here to talk to you guys today. And just to kind of give you a layout as to what we're going to do tonight, our panel of experts are all going to talk to you first. We're going to have our student, Zack, as well as our three wonderful clinicians who will give their talks. And then we will also have kind of a portion of time that we can spend taking your blood pressure. You can learn how to take your blood pressure. We hope it's really interactive and fun for all of you to learn. And then since this is our final session, for those of you who have attended 3 or more sessions in person, we will have our certificates as well as swag that we'll hand out at the end. And with that, I'll hand it off to Rochelle, who helped to organize the session today.
So it is my pleasure to introduce our student warm-up talk, it will be given by Zach Billman. Zach Billman came from the University of Washington in Seattle, and he joined UNC's MD-PhD program, where he received his PhD in microbiology and immunology. And he's currently in his 4th year of the med school curriculum, so the final year of the program. And he'll be giving a talk to you all today about blood pressure. So with that, please give a warm welcome to Zach Billman.
I'm happy to be able to talk to you all today. I think this is so fun, so interesting. And I think blood pressure is something that we often talk about, we often hear about, but it's pretty complex. There's a lot going on. And I just want to introduce you all a little bit to blood pressure and how I think about it as a 4th year med student. This is the panel of experts coming up later. I'm not sure if I'd include myself, but I'm very happy to talk to you all about it. And hopefully like what it is and talk about a little bit about how you can measure it. And so this is sort of what I just said, right? I'm going to talk a little bit about what's going on and be followed up by our 3 experts, Dr. Hinderliter, Dr. Voora, and Dr. Deyo. And then at the end, we can take blood pressure because I think it's kind of fun, actually, when you do it the old-fashioned way. And so basically, by the end of today, I would be so pleased if we knew what the numbers meant when we're looking at a blood pressure cuff, right? Why are there 2? And what controls your blood pressure, like what organs in your body work together to regulate blood pressure, and why you should care. And I will also be supported by our physicians. And what I think is more fun is how it's measured, and maybe we could get into that. But I think this is very important to talk about why are there 2 numbers, right? And so I think the best way for me to think about this is thinking about it like a balloon. Will be interactive today, but their blood pressure, hopefully I don't pass out, but you know, if you think of your blood vessels like a balloon and your heart's pumping, your heart squeezes and your heart relaxes, right? You could tell the pressure is higher and the pressure is lower when it's not squeezing, right? So your blood pressure is kind of dynamic. It goes up and it goes down and up and down. And so the top number is the number when your heart's squeezing, and the bottom number is when your heart's relaxing. And so in fancy doctor words, we use the term systole for when the heart is squeezing. You can see this heart is squeezing, it's pushing the blood up, it's going up into your aorta and your arteries and your blood vessels. And diastole, or the relaxing part, this is the bottom number, that's 75 on that previous diagram, where your heart is relaxing and the blood is flowing into the heart. Not sure if this is working that well, so I think I'll do it this way. But when we're talking about what organs control your blood pressure, I was just curious what you all think. So we have pressure sensors, like parts of our body that can measure how much pressure is being pushed through, and also volume, which is a little bit different than pressure, like how much blood flow is going on. But I was just curious, what do you all think about where your pressure sensors might be at? Does anybody want to venture a guess? I'll answer this one, and we could talk about, yeah, the heart. This is a great guess, very important. It's the blood vessels themselves. So we actually have sensors in our aorta, which is that first part where it comes out of the heart, the first big blood vessel, and also in your carotids. And these have sensors that signal to your brain about how much pressure is coming through. Your blood vessels are elastic and they open and close. Well, they expand and contract, I should say, right? But this is something that I thought was very cool and very curious and not, I think, immediately apparent about a very important organ for controlling your blood pressure. And that is the kidney. The kidney is one of our most important organs for controlling blood pressure. And so I think the way I think about this is that the kidney senses how much blood is flowing into the kidney. If there's not enough blood, it says, oh, sends a signal to the brain, I need more blood. Let's increase our blood pressure and squeeze more blood into the kidney. In your carotids, it measures the pressure and feels, okay, is there enough? Like, is the pressure up to the carotids enough? Am I getting enough blood flow to the brain? And similar with the heart, the aorta, and the right atrium, this is where the blood first enters the heart. And all of these signals get integrated and sent to the brain, and then they get sent back to the blood vessels. But I kind of want to just think about this for a second. This is a very complex system, right? There's a lot of different signals. It's not just, okay, I need blood pressure right now or not. There's many different parts of the body that are working together to say, do I need to increase blood pressure or decrease, right? And so the brain then signals down to your blood vessel, the arteries in particular, and it says whether should you constrict or relax. And I think this is something else that's worth thinking about for a second. Because if you look at a blood vessel, I want you to focus on this middle section right here, this kind of light pink area. Your arteries have muscle. It can squeeze, it can like constrict and relax, just like other muscles. These are smooth muscles, so it's a little different. But I think it's very important to think that these are like dynamic vessels, right? And they can squeeze, they can squeeze and contract. They can squeeze to increase blood pressure. They can also relax to lower blood pressure. So this can happen all over the body, and it's a really complex, beautiful system, right? And so now I want to talk a little bit about when your blood pressure is too high. We're often worried about that when you're out in the clinic seeing your primary care doctor. And this, for the medical term, we call it hypertension, where it's too high. And so blood vessels are normally, like I'm trying to describe, elastic. When the heart squeezes, they can handle the pressure. During your surgery rotation, you can see like really beautiful blood vessels, like dynamically changing as the heart pumps, which is a very cool experience. And I want to show you a picture of a blood vessel with hypertension. You might think, wow, Zach, these look exactly the same. And you'd be correct, because you can't tell by looking at the blood vessel itself necessarily. There are some changes that I'll get to. But the blood vessel itself, it doesn't visibly change necessarily. And the main things we're thinking about is the pressure inside. So normal, meaning not hypertensive, has this lower pressure that's pushing outwards on the inside of the blood vessel. And hypertension, this pressure is a little too high. There's a little layer here. It's a yellow. It's not terribly important right now, but this part is a little bit stiffer in people who have had hypertension for a long period of time. But you can imagine if you are a blood vessel and you are experiencing this high pressure over and over and over, constantly for long periods of time, that this can wear down on you, right? And when this happens, you have this little very small micro damage that can appear in other parts of your body, in the blood vessels, I should say. What I've tried to show here is like little cracks. It's not like necessarily like that, but small little bits of damage, just too much pressure over time. And if this, fortunately, our bodies are able to heal, right? And we can repair the blood vessels. But if this happens over and over and over, a little bit of damage, a little bit of healing, a little bit of damage, a little bit of healing, this can create a situation that's not as good as it was before. And this sometimes can lead to plaques forming, but essentially, I want to try to impress upon you that the blood vessel becomes less good at delivering blood to important parts of your body. And how does that manifest, or how does that feel to somebody who's had hypertension for a long period of time? And that, just imagine blood that you want going to these important organs. If that doesn't happen, what does that occur as? Meaning, if you don't have blood going to the brain, it's a stroke. The small blood vessels in your eye can have the blood flow to them blocked, and you can lose your vision. The heart, similarly, your heart doesn't get good blood flow, you can have a heart attack. And as I was talking about before, the blood flow to the kidney is very, very important, right, for controlling blood pressure. If you don't have good blood flow to the kidney, these precious blood vessels, your kidneys can fail. And so I think I will let Dr. Voora talk to us about, how blood pressure can be lowered. The way I think about this, which is, I think, trivializing it a bit, but the things that we kind of know that are important to do for you, but are pretty hard to do regularly, like let's sleep well, let's exercise regularly, let's eat well, all of these activities contribute to a healthy system of all those complex networks that go from your body up to your brain to make sure that you have appropriate blood flow, or I should say blood pressure. And so that's most of what I have to say about introducing blood pressure, like why we care about keeping our blood pressure at a normal level, a normal pressure. And now I want to talk about measuring blood pressure, because I think, we've all had the experience, or I presume we've all had the experience of having the blood pressure cuff on your arm. Like, oh my gosh, why does it have to squeeze so hard for it to like find out what my pressure is? Why can't you just like sense it somehow? And I think hopefully we can explain why it needs to be so tight in the next few slides. But we also have a really fancy, funny word, sphygmomanometer, for the blood pressure cuff. And I did practice that a number of times before talking to you all today. But the principle behind the way this works is that when the blood flows through your blood vessels, typically, it is very smooth, laminar, and it's a perfectly smooth flow you can imagine. And this will come back. But we are interested, right, in finding out what is the highest pressure and what's the lowest pressure. That's how we'll get like the top and bottom numbers on our blood pressure cuff, right? And so if you look at this blood vessel, and so we're looking for the highest and lowest pressures, like I said, systole, diastole before. And if you get just to the left of this blood vessel and you put your blood pressure cuff on and squeeze it really hard, you squeeze it so strongly that it's more pressure squeezing down than your heart is able to push out, right? And so that's why it is fully closed. And when that happens, the blood cannot flow through. And you put this blood pressure cuff on and you slowly lower the pressure. And as you slowly lower, first, it's equal to the highest pressure. And then when it gets just a little bit lower, you'll see the blood vessel opens up a little bit when the heart squeezes, right? And who cares, you might be thinking, but we know from physics a little bit, to bring you back, that use the laser pointer. When fluids flow from an area of a small tube into a larger tube, there's a little bit of turbulence. And the turbulence, in this case, leads to some noise. You can hear a little if you listen with the stethoscope. And this technique of slowly lowering the blood pressure and just listening to those little noises, these are called the Korotkov sounds. And Nikolai Korotkov was a physician, a Russian physician, and around 1903 or so was the first time he talked about this. And I think that's like really curious. And we've been doing it the same way and by the same principle since then. And it works really well. But to kind of close out from here, so as the blood pressure cuff gets lower and lower and lower, the more blood flow flows through until when the blood pressure cuff can't even squeeze enough to like close the blood vessel at all, the sound goes away, and now you have perfectly smooth flow again through your blood vessels. And that's how both when you do it manually, listening to, and the blood pressure cuff, the automated machines kind of feel for like the pulse of your heart like pushing out, but it's a similar kind of concept, I guess. And so this is why it has to go so tight, so no blood flows, and then it slowly goes down until a little bit goes through. And that is all I have to talk to you about today. And I think I'm gonna hand off the mic to Dr. Hinderliter. And this is a picture we'll come back to later, but this is when, if we all do this later, we can talk about this. But this is just a different picture that shows the same thing. So thank you all for listening to me. Hope that made sense, and we can answer questions and stuff, I think, later at the end if you all Michelle, we'll need your help.
All right. Well, good evening. Thank you all for coming, and thanks for the organizers for having us. It's really a pleasure to be here today. Can you hear me okay? Yep. Okay. So my name's Hinderliter, and I want to talk to you for the next 10 or 15 minutes or so about measuring blood pressure, a concept that Zach got into a little bit, but I want to elaborate a little bit more on his comments. And that was a great introduction, by the way, to high blood pressure. So how do we know if we have high blood pressure, each of us? Well, it turns out that for the most part, having high blood pressure doesn't cause any symptoms. So until you have some of the manifestations that Zach talked about, like a heart attack or a stroke, you're totally without any signal that you have high blood pressure unless you have it measured. So that's why it's important to have it measured at your provider's office. And I think, and I know my colleagues believe this too, that most people with suspected high blood pressure should measure their blood pressures at home. And that's what I want to talk about primarily tonight. So why do we need to measure our blood pressures at home? Why can't we just rely on the measurements that are made in our healthcare provider's office? Well, there are a number of reasons, actually. First of all, sad to say, sometimes it's not done with as good as technique as we would like. So we'll talk about appropriate technique tonight. And next time you go to your physician's office and have your blood pressure measured, see how close they come. Oftentimes, to be honest, we're a little sloppy in the clinic. Secondly, there can be a lot of variability between observers making the same measurement, particularly if you use the old-fashioned cuff that Zach was talking about. Thirdly, and probably most important, is that what we get in the office is just a snapshot of what your blood pressure is. It may not really reflect what your blood pressure is over the course of the day. Once you start to measure at home, you'll see that blood pressure varies a lot. It'll vary from moment to moment. It'll vary from day to day. So we're just getting one measurement, or maybe hopefully two or three measurements in the clinic. That's a snapshot. And that may not reflect very well what your blood pressure is over the course of the day, your true quote unquote blood pressure. And lastly, if we rely just on office blood pressures, we won't be able to detect what's called white coat hypertension or masked hypertension. I think a lot of you probably know what white coat hypertension is. Many of us have kind of a reflex when we walk into the physician's office, our blood pressure goes up, while it's much better at home. There are some people who have just the opposite. Their blood pressure may be a lot better at home than or better in the office than it is at home. If you have, a couple kids running around and that sort of thing, the most relaxing part of your day may be coming to see your doctor. So those are reasons that it's important to measure blood pressure at home, I think. And if you're going to do it, you should do it well. We have a saying in medicine that bad information is worse than no information at all. So if you're going to measure your blood pressure at home, it's really important to do it correctly so that you'll give your provider accurate data with which you and your healthcare provider can make decisions. So these are 7 simple tips for getting an accurate blood pressure measurement. And the slide on the computer is small, and I'm old, so I can barely see these. But the first thing is to empty your bladder before you take your blood pressure. If you're sitting there and you really need to pee, your blood pressure is going to be higher than it is at other times. Secondly, let me slip over here so I can actually read this. Support your back. So sit in a chair like you are now with your back supported. Keep your legs uncrossed, feet on the floor. Support your arm at heart level. Importantly, take your measurement on a bare arm. You will sometimes see, even in physicians' offices, blood pressure is being measured through a flannel jacket. That's not going to give you an accurate measurement. And don't have a conversation while you're having your blood pressure measured. That will raise your pressure also. And if you look on this slide, you see that violating some of these rules can make a big difference in what your blood pressure is. 10, 15, 20 millimeters mercury. That's 2 or 3 medications worth of blood pressure lowering. So paying attention to those strategies for getting an accurate blood pressure measurement is really, really important. So when and how often should we measure our blood pressure at home? We as physicians are guilty, I think, of not providing enough guidance to our patients about how to do this. Here's what we tell folks in the hypertension clinic. You should abstain from caffeine and exercise and smoking. Oh, you should abstain from smoking, period. But all those activities for at least 30 minutes before taking your blood pressure. When you take it, sit down and rest for 5 minutes first. And then take a couple measurements, 2 or 3 measurements. Write all of them down. Even if you think they may be incorrect, write them down so you can show those offices or those numbers to your physician. And how often we have folks do it kind of depends on the circumstance. In somebody who's got pretty good blood pressure control, we may recommend doing it 1 day a week or maybe a day every couple of weeks. And then in the week before you come to see your physician, try to take it every day if you can. And that'll give us enough information to really make some good decisions about management of your hypertension. Keep a log and write all these numbers down. Don't just give us the good ones. We want to know the bad ones too, so no cherry picking. And importantly, we talked about how blood pressure varies from moment to moment and day to day. Don't be alarmed by occasional high blood pressures or occasional low blood pressures. That's going to happen. Blood pressure is variable. What we're really interested in is the average blood pressure over the course of the day. And I really, really counsel my patients not to treat isolated elevated blood pressures. It's going to come down. It varies. It'll be higher today than it is tomorrow and vice versa. So it's better to avoid the temptation when you get a measurement that's a little high to double up on your medicines or not take your medicines if it looks fine. At the end of the day, if you do that, you just contribute to this variability. You're taking different doses of your drugs every day, and it's really going to make things difficult for both you and your physician to know how to adjust your medications. And lastly, establish a time to measure your blood pressure. We generally recommend first thing in the morning, then late afternoon or early evening. Don't just measure it when you feel poorly, because it probably is going to be higher, and that's not really an accurate reflection of what your true blood pressure is. Importantly, what sort of device should I buy? As a rule for home blood pressure monitoring, we actually nowadays prefer the automated devices, because just pumping up a blood pressure cuff can actually raise your blood pressure. And for most patients, arm cuffs are the best. Some folks who can't find an arm cuff that will fit them well may be better off with a wrist cuff, but 95% of people are better off with a device like those that you see on the desk with an arm cuff. It's important that you pay attention to the cuff size, and usually cuffs will tell you what size arm they'll fit, and they'll have markings on it that help you be assured that it fits appropriately and the cuff size is correct. And lastly, make sure your device is validated. Only about 5% of devices that are advertised on Amazon have actually been validated independently. So they may still be okay, but you don't really know that. And you would much rather have an accurate device than one that gives you data that's not really reliable. So there are a couple of websites that you can go to that list validated devices. Though probably the best is one run by the American Medical Association. It's validatebp.org. And they have a pretty comprehensive list of blood pressure devices that are sold in the US and will tell you if they've been independently validated. So these are some devices that we recommend in our clinic. Again, these aren't by any means the only validated devices, only accurate devices. But a company called Omron, and I have no stock in Omron, makes good devices. They've sort of been the industry leader for a lot of years. And again, you can go to Validate BP and get lists of other manufacturers also. But I always liken buying a blood pressure monitor, home monitor, to buying a car. You can get a perfectly reliable car that will get you to and from work. Or you can get one with lots of bells and whistles for a little more money, or maybe a lot more money. Same thing with blood pressure devices. The key thing is to get a device that gives you good numbers, accurate numbers, and that you have confidence in and your physician has confidence in. If you want some bells and whistles, that's nice. There are some, for example, that will communicate with your cell phone by Bluetooth and give you nice printouts. Those are quite nice. Some will average 3 measurements that you take. They'll automatically take 3 measurements and average them for you. That's kind of nice. So there are good features that you can get on your device for a little more money, but not essential. And you can get a high quality blood pressure monitor for something like $35 or $40. So you don't have to break the bank. So this is the kind of record that I love to see in clinic. This is an 89-year-old lady who monitored her blood pressure at home. You can see 3 measurements in the morning, 3 measurements in the evening, every day for a week before she came to see me in clinic. Blood pressure records are not always like this. Sometimes, they're scribbled on a napkin that's got mustard and stuff on it. And I have a feeling that patient probably stopped at Hardee's on the way to clinic and wrote down some numbers to keep me happy. But sometimes these records provide kind of a neat insight into the patient's personality. So this is a systems analyst. These are very organized people. You can see this record is color coded. So I think, if I remember correctly, orange was systolic blood pressure more than 140, yellow between 130 and 140, no color in the clearly desired range. This was a blood pressure record from a physician an older physician, didn't really like computers. He liked graph paper though, and lots of it. This was his record over time, and by the time, a couple of months had gone by, this thing stretched for most of the length of the hallway in the clinic. Any idea what occupation this patient was in? Yeah, he's an engineer. Yep. So you see here a graph with a second degree polynomial curve fit. Anybody know what that is? I have no idea, but it makes for a nice graph. So some of these are really sophisticated. I want to touch just a bit. So let me say that correct office blood pressure measurement is really important, and we emphasize that in our clinic, certainly. Home blood pressure monitoring is our go-to way for monitoring blood pressure outside the clinic. So again, we really think that's important, and every patient with high blood pressure should do it. There is another way to monitor blood pressure outside the clinic. I just want to introduce you to. It's not one we use often, but can be helpful, for example, as a tiebreaker if your office and home blood pressures are a lot different. It's called ambulatory blood pressure monitoring. And you're basically equipped with a device much like those, but miniaturized, so you can wear one on your belt. Inflates, deflates at intervals that we set. And the thing has a brain and a memory and can produce a record of your blood pressure much like this. So we get a really nice graph and lots of statistics, average blood pressures during the day, during the night, over 24 hours. Very useful technique, although not one that patients like to do often, I must say. And again, this is useful in some patients, but home monitoring is really our go-to method. So those are some of the essentials, I think, of something that's really important for you as patients if you have high blood pressure to do, and something that really helps us out in the clinic when we try to make decisions about how to modify your therapies. So thank you. I'm going to turn the mic over to Raven, Dr. Voora, who will talk about a very important strategy for helping manage blood pressure, and that's lifestyle modification.
All right, well, good evening, everybody. Before I begin, I just want to thank the organizers, our MD PhD students, for putting on a really wonderful conference. And I also want to thank you all for making time and being interested in this topic of blood pressure. My name is Raven Voora. I am a nephrologist. I am a kidney doctor at UNC. And as you heard from Zack, we are very interested as kidney doctors in blood pressure. The kidneys can contribute to high blood pressure, and likewise, high blood pressure can actually damage the kidneys. And so that's why me as a kidney doctor is very interested in hypertension. So I'm going to talk about lifestyle modifications. You've already heard from Zack and Alan, what is blood pressure, how we measure it. We're now going to switch gears and talk about how can we manage high blood pressure. I'm going to talk about lifestyle modifications. Zack Deyo is going to talk about medications. So when we think about lifestyle modifications or lifestyle changes that we can do to lower blood pressure, what comes to mind? What lifestyle changes can be done that can lower blood pressure? Anybody have any ideas? Zack shared some already in his slide. What comes to mind as being important? Exercise, excellent, definitely. And we're going to talk about that today. What else? Yes. Mediterranean diet, excellent. So having certain dietary eating plans, absolutely. Yes. Stress management, yes. Anything else that comes into mind? Yes. Smoking, yeah, not smoking, stopping smoking. Great, these are all great ideas. So let's get into it, so perfect. So when we think about lifestyle modifications or lifestyle changes that are important in managing high blood pressure, these are probably the most important ones. And I will also point out that these lifestyle modifications, these lifestyle changes can also be important in some people in preventing high blood pressure. And the ones that I'm going to really touch upon today are weight reduction, a DASH eating plan, sodium reduction, increased physical activity, and consuming alcohol in moderation. I heard stress was mentioned and smoking cessation. I'm not going to touch upon those during this 15-minute talk, but I'm happy to talk more about it during the Q&A session. And then sleep was mentioned earlier. I'm going to touch upon that at the end of my talk. And as you can see here, if you make these lifestyle changes, your blood pressure can come down on average by about 5 points for the top number, systolic. And in some people, the blood pressure can come down even more. And so it can be really, really crucial in managing high blood pressure to make these changes. Not only is it helpful for managing high blood pressure, making these lifestyle changes has other benefits, right? They reduce the risk, some of those diseases that Zack told us about, stroke, heart disease, kidney disease. And overall, it just enhances your sense of well-being, right? When you go out and exercise, you have a healthier weight, you feel good. You feel good about yourself, and that's really priceless. Also, depending on who you are and what changes you make and what effects you have, it can actually decrease your need for medications, and in some cases may eliminate the need for medications. So when I start by talking about weight reduction first, what are some key facts? You know, when you're overweight, being overweight really does put a lot of strain on your body, put strain on your heart, even put strain on your kidneys, and certainly increases your risk for high blood pressure. To lose weight, it's the basics. Move more, reduce your calorie intake, and eat a healthy diet. And in terms of what you need to do for yourself, really is a conversation you should have with your healthcare provider about what approach you should take, how much weight you should lose, and determine what activities are best for you. As I already mentioned, there's lots of benefits to weight reduction. Couple key pointers to help you to be successful. One of the first things is setting realistic goals. is not realistic, right? To say, oh, I'm going to lose 10 pounds in this next month. Yeah, that's just not realistic. So really set realistic goals. A number that's often thrown around is that a healthy goal for weight loss would be 1 or 2 pounds per week. So about anywhere between 4 to 8 pounds of weight loss per month. And the reason why it's really important to set realistic goals is because a slow and steady approach with that, you're more likely to achieve long-term weight management, right? Because when you make gradual changes, you're more likely to stick with these changes than if you do something drastically. Other things that can be helpful in having a healthier weight and weight reduction is paying attention to portion size, right? Something that leads to excess consumption of calories and overeating is portion size. And you may have heard this thing called portion distortion. I don't know if anybody's heard of that, but it basically refers to this phenomena where our perception of what constitutes a normal serving size of food has really changed, right? So a small size of McDonald's fries now is equivalent to what a large size was, 30 years ago when I was a child. And not only that, has the serving sizes changed, our expectations have also changed. And as a result, our expectations have changed. Our brains and bodies are expecting more. So this happened to me about a month ago. I was out to dinner and my kids, we got some fries. And I was kind of saying, oh, this is all the fries I'm going to get from this? I'm used to, I feel if I'm paying this money, I want a big size, I want a bunch of fries for us all. So this is just kind of what happens. And this is called portion distortion. But the problem is when we eat more, we consume more calories, and this contributes to excess weight. And so how can we address these rising portion sizes? Well, some tips that our dietitian recommends is actually using a smaller plate, right? Let's trick our brain. Have a smaller plate. The portion size will naturally look bigger, or a smaller bowl. And so it's really important to pay attention to portion sizes. A quick way is using your hand, actually. Your hand can actually be a good guide to what a healthy portion size is. So actually, as you can see here from this figure, your palm is about equivalent, the size of your palm here is about equivalent to the size of about 3 ounces of protein. So 3 ounces of fish, 3 ounces of poultry, 3 ounces of beef. So you can use that if you're at a restaurant or you don't have access to a measuring cup, use your hand. So that's 3 ounces of protein. Your fist is a cup of carbohydrates, a cup of rice, a cup of grains, a cup of cereal. And then your tip of your thumb from here to here is equivalent to about a tablespoon. And that's helpful when you're thinking about condiments like peanut butter, mayonnaise, salad dressing. That's a tablespoon. Here, the thumbnail here, that's equivalent to about a teaspoon. Also helpful for condiments. And the last thing that you can see here is your cupped hand. So when you cup your hand, that cupped hand is about equivalent to about a half a cup of a serving size. So a way that you can, easily use your hand to assess for portion sizes. Another way to help with weight reduction and decrease your excess calorie intake is to look at what you're drinking. A lot of people drink a lot of their calories. Sodas, have a lot of calories. Sweet tea, right? We're in North Carolina. Sweet tea, I read that the sweet tea that you get at McDonald's, if you get a large size, that can be up to about 350 to 400 calories just right there in sweet tea. That adds up. So think about where you're getting your calories from, and you may be actually from liquids. So these are just some helpful pointers to help you on the road to weight reduction. So also important is following a heart-healthy diet. You had mentioned the Mediterranean diet. So let's talk about a heart-healthy diet. And the one that you oftentimes will hear about when we're thinking about managing high blood pressure is something called the DASH eating plan. Mediterranean diet is also another version as well. So a DASH eating plan can really help you to manage high blood pressure. So what is the DASH eating plan? So DASH stands for the Dietary Approaches to Stop Hypertension. It is basically referring to a heart-healthy eating plan for life. There are no special foods, nothing special that you need to buy, and we'll talk about what's involved in it. But basically, it provides some guidance for how many servings that you should have on a daily and weekly basis, and some nutritional goals. You'll see, as I show you on the next slide, you'll see that the DASH eating plan means that you're eating a lot of fruits, vegetables, and whole grains. And naturally, by doing that, you're avoiding sodium, which we'll talk about as being an ill factor for high blood pressure. But it also means that you're eating a diet rich in potassium, calcium, and magnesium, very important minerals that we need in our body. In addition, as you'll see in the next slide, the DASH eating plan really emphasizes eating fat-free or low-fat dairy products, fish, poultry, beans, nuts, and using vegetable oils. And in general, you're really consuming foods that are limiting foods that are high in saturated fat, and certainly not consuming trans fats and limiting sugar-sweetened beverages and sweets. So this is the DASH eating plan. And so this is an example of some of the daily and weekly servings that meet the DASH eating plan for a 2,000 calorie a day diet. And you can see, again, nothing fancy. You're having 6 to 8 servings of grains on a daily basis. They're mentioning 4 to 5 servings of vegetables, 4 to 5 servings of fruit, low-fat dairy products, 2 to 3 servings. But you can see it's naturally lower in sodium, on average about 2,300 milligrams. And you can see that you're really limiting your intake of sweets and saturated fats. So I talked about sodium. Let's talk about that a little bit more. It is vitally important in managing hypertension or high blood pressure to limit your sodium intake. And they say that Americans have really developed a taste for salt and that we have just become accustomed to higher sodium in our diet. And when I'm talking about sodium restriction, I'm not just saying, don't add salt to your food when it comes to the table. That's really important. One of the major places that we get sodium is actually the salt that's already in our food, the sodium that's already in our food. Whenever you're consuming foods that are processed or prepared outside of the house, it's guaranteed to have a lot of sodium. So even if you're not adding salt to that food, when you're getting foods that are processed, that are packaged, it's going to be much higher in sodium, right? Because that's how it stays good on the shelf for a long time. In terms of recommendations, the American Heart Association really recommends that we consume no more than 2,300 milligrams of sodium a day. That's equivalent to about 1 teaspoon per day. And then ideally, if you have high blood pressure, we try to really limit your sodium to something even lower, 1,500 milligrams a day. And so to do that, the DASH eating plan can help you to achieve that, but really eating more at home, eating more fresh items, and really staying away from processed and packaged foods, and actually staying away from eating outside the house, like restaurant food, takeout food, fast food. That is really the way to achieve that. Another thing that can be really helpful as you're trying to determine is this food higher in sodium or not, is to really look at the food label, right? The food label has a lot of information. And one of the first things to do when you're looking at a food label is look at the serving size there in yellow. Sometimes you'll be surprised that it actually may be a lot smaller than what you think as to what a serving it may be. And then when you're looking at the pink area, that's telling you the amount of sodium, and it's usually listed in milligrams, right, mgs. And then next that it'll also tell you what is that percent daily value for sodium, which indicates how much of the recommended daily amount is in that one serving. In general, I try to tell my patients, to try to make sure that number next to sodium is some number less than 300 milligrams. If you do that, that can try to keep you to eating a food that's, maybe not as high in sodium. But how the food label can help you is that if you have two cans of soup there, which we know are going to be higher in sodium, use the food label. Look at the milligrams of sodium. Look at the percent daily value as you're helping to compare items when you're going food shopping. This is from the American Heart Association also. I don't know if you've ever seen this. It's called the Salty Six. So the AHA, the American Heart Association, identified 6 very popular foods that are near and dear to a lot of us that are a significant source of sodium in our American diets. Pizza, burritos, tacos, soups, right? Soup has a lot of sodium in there. A lot of patients will tell me, I'm just eating some soup, should be fine, right? But no, it's full of a lot of sodium. That's why, again, it has a good shelf life. But other ones that you may not have thought about is actually bread, right? There's actually salt. Salt is made of sodium chloride. So there's salt that's used in the baking of bread. And then the other one is these cold cuts and cured meats. 6-thin slices of deli meat can contain as much as a third of your daily recommended dietary sodium. You have a sandwich, 2 pieces of bread, put some cheese, you have some deli meat. Let's not talk about it. But things to think about. And then some final tips about when you're eating out, right? So I mentioned if you're going to go out to eat, you're running the risk of consuming a lot of sodium and a lot of extra calories, right? So just think about where you eat out most. Try to print out the menus. Find out what some healthier options might be before you go to that place. If you can, request some items to be made, no salt or lower salt, if you can. Certainly the chefs will have to do a different preparation strategy. And then we talked about portion sizes, get a to-go container up front. Save half for another day, or share the other half with whoever you're having dinner or lunch with. Just think about that. And then you can save those leftovers for another time as well. So moving on, I want to talk about physical activity. I know you mentioned that. Let's getting active. Getting active can really help to control your blood pressure. Not only can it help to control blood pressure or lower blood pressure, but it also has ancillary benefits, right? It helps us to maintain a healthier weight, helps to manage stress. And key things is when you're really wanting to become active, like our patients say, I know I need to do it. How do I get started? First of all, find something you like to do. And if it's walking, great. That's a great place to start. Make it social. See if you have a friend who wants to go walking with you, wants to hit the tennis ball with you. You're more likely to be successful and keep with it if you're accountable, right? And you enjoy it. And also take advantage of resources in your community, like the YMCA here in Chapel Hill has quite a few programs here. We're blessed to have lots of parks here in Chapel Hill and Orange County. Take advantage of those places. They're really safe places to exercise and get engaged in programs. How much exercise should we be engaging in? Well, these are the recommendations from the American Heart Association. We should be aiming for 150 minutes per week of moderate intensity of aerobic exercise. That equates to about 20 minutes a day if you exercise every day, 7 days a week. And it is recommended that you incorporate some muscle strength training and resistance training at least twice a week. So what is moderate intensity? So these are the examples of physical activity levels. There's light, moderate, and vigorous. Again, the goal is for you to be in that purple middle category, moderate. And you can see examples of that. That's walking briskly at a pace of 4 miles per hour. That's pretty brisk. And then, of course, other activities that you could be doing around the house, playing doubles, tennis. That's an example. But I don't know if you've heard about this conversational pace test. So if you're not sure, hey, am I taking it too easy, or am I doing too much, or am I just right? There's something called this conversational pace test. So if you're able to have a conversation with somebody comfortably, but can only exchange like brief sentences at a time, and then have to get it and then catch your breath, then you're probably doing the right intensity. But if you're able to talk for like 10, 15 minutes and don't have to pause or stop, you're probably in the light category. And then if you're huffing and puffing and saying, I got to stop exercising, then you're probably in too vigorous of the category. So checking on how easily you can have a conversation is a quick check to see if you're exercising at the right intensity. Alcohol. So one thing that sometimes people don't think about is that alcohol can affect blood pressure. Drinking too much alcohol can really raise your blood pressure. And then some people would tell me, hey, doc, I'm drinking red wine, or should I start drinking red wine? Red wine's not a miracle drink for heart health. And so if you're not drinking, no need to start. Okay, let me just put it that way. But if you are drinking alcohol and drink, these are kind of what we consider the limits. So we limit alcohol to 1 drink per day in women and 2 drinks per day for men. And what constitutes a drink is listed here depending on what you're drinking, whether it's beer, wine, or whiskey. But again, red wine's not a miracle. You don't need to start drinking red wine because you think that it's going to help your blood pressure. So just to be clear about that. And then in my final slide, just want to reiterate that sleep really matters. And this has really become a focus now for us as providers is really asking, my patients about their sleep quality. And we have lots of data demonstrating that when sleep quality is poor, getting up a lot in the middle of the night, working third shift, not having a regular pattern, this can really affect your health, increases your risk of actually adverse outcomes, increases your risk for heart disease, and certainly increases your risk for high blood pressure. And so the aim is to have 7 to 9 hours of continuous sleep per night that can actually help to lower blood pressure. So I didn't address smoking and I didn't address stress, but I'm happy to talk about that during the Q&A session afterwards, as well as any other questions you have. So thank you for your attention. I'm now going to pass things over to Zach Deyo, who's going to talk more about medications.
Good evening, everyone. My name is Zach Deyo. I'm the clinical pharmacist on the team, and I want to spend a little bit of time talking about successful medication management. Certainly, we'll talk about this through the lens of how medications can be used to better manage high blood pressure, but I think some of the tips that I'll show you hopefully could be applied broadly to thinking about use of medications and engaging with that. So, I think one of the ways that you can become more engaged in managing your medications is to think about answering these 3 questions. And what I've done here is I've taken what we call 3 prime questions that we teach pharmacy students to ask patients to assess their knowledge about medications when you're picking medications up at the community pharmacy, and showing those to you here written in a little bit of a different way so that you can think about this. So what is the medication for? So think about if someone is prescribing a medication for you, making sure you walk away from that clinic visit understanding what the medication is for. Sometimes medication could have a dual purpose, but oftentimes in this context, it could be a medication to help lower blood pressure. It could be for cholesterol or diabetes or even something else, a chronic condition, or maybe something more acute like an antibiotic for pneumonia, for example. So what is the medication for? And then making sure you understand how do you take the medication. And so that could be as simple as, do I take this once a day or twice a day? How long do I take it? But other things too, should I take it with food? Would I expect any interactions with something that I'm eating in my diet or other medications? Seldomly, medications can be sensitive to light or to moisture, and so the way that you store them can be important as well. So I think those are all factors to engage on. And then lastly, what can I expect from this medication? So this would be, what is the intended effect? So in the case of managing high blood pressure, we're expecting this to lower your blood pressure. Dr. Hinderliter talked about ways that you can engage to assess that at home, but also what are some of the possible side effects? What could be need for monitoring? So beyond monitoring your blood pressure with a blood pressure cuff, for example, at home, some of the medications that we'll talk about require you to come in periodically for some simple blood tests to measure things like your blood sodium and potassium and your creatinine, which is a marker of your kidney function. So I think these are 3 great questions to engage with medications. When it comes to choosing blood pressure medications, I wanted to talk just about a few of the different factors that we might be thinking about. And I think in medicine now, we talk about something called shared decision making, which is partnering with the patient to share our knowledge and make a decision that's best for you as an individual. We have blood pressure goals that we're targeting that are expert consensus based on evidence points us to for most people, but that may be individualized, a little bit tighter blood pressure control or not as tight, depending on various factors. We also, you should be getting some basic laboratory tests when you're first engaging with your physician visit. So what is your blood sodium or potassium, your kidney function? Those kind of baseline markers can factor into how we're selecting medications for you. Other medical conditions are important, and I have a little bit more information on some of my next slides about that, but oftentimes people will have diabetes and kidney disease and other issues with their heart that can guide what are some of the best therapies to use. And then we have, it also depends on what's available. So, we have some medications that are available with 2 or 3 different medications in a single tablet, but not everything is available in a combination. So there's just some of the factors that we think about when choosing blood pressure medication. Now, when we look at what are the first line medications that we think about, there's really 4 medication classes that we think about when we're getting started on blood pressure medications. And those are listed there on the left-hand side of your slide. Diuretics, or specifically thiazide diuretics, play an important role in helping to manage high blood pressure. You may have heard of medications like hydrochlorothiazide, or HCTZ, is very commonly available and in combination. Chlorthalidone is another one. The next 2 in the middle, we never use those together, but the angiotensin-converting enzyme inhibitors and the angiotensin receptor blockers, I think, are options as well. And then the calcium channel blockers, specifically medications like amlodipine, are part of our first line options. But then on the right-hand side, you'll see that for some patients, especially if you had diabetes or kidney disease, with protein in your urine being a marker of damage to the kidney, we know that medications like the angiotensin-converting enzyme inhibitors, or the ACE inhibitors, medications like lisinopril, based on clinical trial evidence, do more at protecting the kidneys and preventing further damage or slowing the rate at which damage is occurring to the kidneys, even more than just their ability to lower blood pressure. So we're trying to think about these things in kind of the second and third layer of determining what are the best medications for you. In a similar way, having congestive heart failure, especially if your heart pump function is weak, there are specific medications, and some examples are listed there, that clinical trial evidence has shown that patients live longer, feel better, and stay out of the hospital, and can recover some of that heart pump function, possibly by being on these evidence-based medications. Some of those you see there are listed under the first line medications for blood pressure, but some of them are not, like the beta blockers, like metoprolol or carvedilol. So that can be a factor as well. And then a similar kind of line of thinking, if you've had a heart attack or a stroke, thinking about specific medications that may be beneficial. I've listed some of the basic dosing, a simple explanation of how the medications work, and some of the most common side effects. I will point you to the link at the bottom of the slide. Actually points to a website that we have for our clinic, and you can find some of this information available there to look at it in more detail. I think I really appreciate Zach did such a nice job of introducing this topic, but in a very simple way, you can think about these medications are targeting some of the effects that's occurring with the biochemical cascade of events that happens when these sensors that he spoke about in the various places in the heart and the kidneys are sensing changes to blood pressure. And our strategy largely is to try to think about medications that target different parts of those pathways. So they may block a place in the kidney, or a place, again, in this biochemical cascade that occurs. So the first one listed here, the angiotensin converting enzyme inhibitors, or ACE inhibitors. Those are medications that tend to end in pril, like lisinopril. They relax the blood vessels through targeting the effects of angiotensin 2, which is a vasoconstrictor, and blocking those effects. In a small amount of people, they can experience a dry cough. This is a medication class we need to monitor potassium and creatinine in your kidney function a few weeks after starting them. In rare cases, they can cause something called angioedema. So having swelling in the lips or tongue or throat can be an emergency. But we have alternative options. And so oftentimes we're using more and more angiotensin receptor blockers. They have good data as well. They block a different part of this renin-angiotensin-aldosterone system. We're monitoring some of the same labs, the potassium and kidney function, but are less likely to cause a cough or have this angioedema type emergency, for example. One of those medications end in TAN, like losartan or valsartan. Some of the other first-line medications that I showed you include calcium channel blockers, and these relax smooth muscle by blocking the effects of calcium in the heart and blood vessels. In some people, they can cause a headache or fluid retention, and we can do quite a bit to try to start. One of the mantras that we have, I think, is to start low and to go slow, and I think that's part of where I can come into the clinical team to work with people on trying to adjust medications in a way that helps you to tolerate them. And then the diuretics we mentioned, these work in the kidneys, different parts of the kidneys, depending on the diuretic, to help us to pee out more salt and water. And so I've listed frequent urination as a side effect, but really over time, the body should adjust to kind of an equilibrium, and that side effect does tend to dissipate. And I do like to include that in a community talk because I think that's something that gets out there in the community that we hear a lot in our clinic that really puts people off to diuretics, but they can be an important cornerstone of a medication regimen to manage high blood pressure. And we are monitoring your blood sodium, your blood potassium, your kidney function, again, a few weeks after starting those or making a dose adjustment. And then I would say another important class to mention here are aldosterone blockers. And so after being on 3 different classes of blood pressure medications that I've shown you, the fourth one that we're leading to most commonly are aldosterone blockers like spironolactone or eplerenone. And they also work in a different place in the kidney by blocking the effects of aldosterone to help us remove more salt and water. It's important, again, to monitor potassium and kidney function. In a small number of patients, they can cause breast enlargement or breast tenderness, but many patients tolerate them just fine. I mentioned beta blockers. They're not really part of our first-line medications. If you were to be on one medication for blood pressure, aside from having those other conditions, we wouldn't most likely pick a beta blocker, but they can be an important part of a medication regimen. And they work differently by blocking the effects of things like adrenaline to reduce your heart rate with the force of contraction and how hard your heart is having to work. Some people can feel a bit fatigued, but again, I found that oftentimes some of these types of side effects can improve over time when they're started slow and as your body adjusts to them. There are some other blood pressure lowering medications, and we see a good number of people in our clinic that have very difficult to control high blood pressure for a lot of different reasons. So we do have some other options. I would say for some of these, they can come with more adverse side effects. And so we have to work with them carefully, but may need to use them as well. So I want to acknowledge that. On the flip side, there are some medications that we ask people to avoid. One of those is our NSAIDs. These are available by prescription, but also commonly available over the counter. Your Advils, Motrins, and Aleve are all NSAIDs. And these are medications that can be very effective for pain management, but when used chronically at high doses over time can contribute to several different things, including high blood pressure, blunting some of the effects or sort of negating some of the effects of blood pressure medications. And they can, I think, put a strain on your kidney through kind of blocking some of the chemicals that are keeping the blood flow open. And so I think it's we say to avoid them. We realize that sometimes you may need to use these, but I think having a conversation with your doctor, your pharmacist on that strategy is important. Oftentimes we say Tylenol is a better alternative, but again, having that conversation I think is important. There are some other over-the-counter medications that can contribute to high blood pressure. medications used for coughs and colds, medications like Sudafed, and some nasal sprays fit in those classes. And then herbal medications as well. So several different herbal medications can also cause high blood pressure or sort of work against some of the effects of the blood pressure medications. So it's important to have a list. Nowadays, this may be electronic, and that's just fine. You may be able to get that through your electronic health record. But I would include all prescriptions and over-the-counter supplements, even those medications that you only take sometimes, because that can be important to know about how often you're taking those. If you can, try to pick one pharmacy. Won't go into the topic of how sometimes you don't get it to choose based on various factors, maybe with medical insurance and pharmacy insurance, but trying to pick one pharmacy and stick with it. And then I would say, once a year, or if you have a surgery or a hospitalization, bringing in a bag of medication bottles can be really helpful for your medical providers to take a look at. Remembering to take your medications is important, but it's challenging. We found that one important factor of helping people to be more adherent to medications is having another person to support them. So a friend or a family member that can support you, it can be very important. Establishing a personalized routine, so that can be very individualized in terms of what works for you. Oftentimes we will recommend people use a pill box because that's a simple visual way that you can see if you've taken a medication for that day or not. There's a lot of technology that's available now, setting reminders on your phones or apps. And then thinking ahead for things that happen throughout the year that may be irregularities in your schedule. So if you're traveling or working late or there's something different happening, try to plan around that. And a lot of these pill boxes have the style you can take the day out and bring it with you, of course. I think one of the things I hear a lot about is the frustration where you may have several medications that are being filled by your pharmacy, and one may be ready this week, and next week you have 2 other ones ready. I think pharmacies are trying to engage with systems that help to sync these up. So if that's a problem for you, I would ask your local pharmacy about trying to sync those up so everything's due in the same month. And again, I think continuing with this theme that I think is important for you to really be engaged is that you really need to speak up about it. Be open about forgetting to take medications. It's better for us to know about that than to maybe feel embarrassed or not wanting to share that. And then, sometimes we hear about people that feel better, so they stop taking a medication, or they may feel worse and they stop taking a medication. And we want to know about all those things. And that's a very common thing that we see in our clinic, as someone may have an adverse effect, and we try to think about, is there something we can do about a different medication within that class or a similar class? Can we adjust the dose? Can we adjust the timing? Is there something we can do to help you out? And then the cost of medications can be very problematic, but can be navigated, and we're glad to help with that as well. What about if you forget? So take it as soon as you remember. If it's almost time for the next dose, it probably makes sense to skip the dose and not to double up. Very rarely do medications have specific timing instructions. One example I can think of are thyroid medications. Probably important to take those at the same time each day. Other medications for heart rhythm disorders can have specific timing directions, but if you're not sure, ask. I think that's the best way to approach that. Again, paying for medications, just some tips here. For the most part, for high blood pressure, most all of these medications are generics, and they've been around for several decades. So that's the case. Even some of the combination therapies are generically available for the large part. Sometimes they can be a different tier on your prescription insurance. But I found that sometimes the cash price for these medications is actually less costly than your copay for your prescription insurance. So ask the pharmacist about that as well. Sometimes a 90-day supply is less costly. Sometimes we can find coupons from organizations like GoodRx, but be open and ask about this as well. I think that's important. So thank you for your time. I think now open up to questions. Yeah. Yeah.
how it would work. But
Now we're happy to open up the rest of our time to hear what's on your mind. What questions, what thoughts do you have after hearing us discuss all these different aspects of high blood pressure? Yes, please.
We're talking about three measurements. Right after each other, if you want, or do you wait?
No, you don't have to wait. I said it's something like that. You wait a minute. We don't want this to be.
Oh, yeah. I don't know. I forgot I had that.
Yeah, so the question was, if you do 2 or 3 measurements at a setting when you measure your blood pressure at home, does there have to be a length of time between those measurements? Do you have to wait for 5 minutes before doing the next one? And the answer is no. Probably wait a minute or something like that, but you can do them in pretty rapid succession.
A lot of times that high blood pressure is genetic. So if the person is with genetic and they start like taking things like changing their lifestyle and taking medications, will that kind of stop the pattern for their descendants?
Yeah, so the question was if high blood pressure runs in the family and it's genetic, can lifestyle modifications, can lifestyle changes still be impactful? And the answer is absolutely yes. So the majority of high blood pressure in our country, when people have high blood pressure, the majority is probably due to genetics, lifestyle factors, environmental factors. So I think that genetics probably accounts for a lot of the high blood pressure that runs in the family. But in these cases, it's still very much modifiable by following these healthy lifestyles. It's not like it's a done deal. If it runs in your family, there's nothing more you can do about it. So absolutely. It's all the more reason, especially if it runs in your family, high blood pressure, to really engage in it. Great question.
And as an adjunct to that, if you do only modification, you're working on it, but you're on medication. How does the doctor determine whether or not he or she is gonna take you off medication and just keep letting you be more medicated? And then doesn't the medication actually change your body's ability to know what it's supposed to do if it's not on medication?
Yeah, it's a great question. The question was, what if you engage in lifestyle modifications while you're on medications? How do we determine maybe when to stop some of those medications? I would say, so, and Dr. Voora showed lifestyle can do a lot. You had a table on there, and we classically see that, for the various interventions, how much we would expect to lower the blood pressure. Some of these lifestyle interventions can be as powerful as 1 or 2 blood pressure medications. And so I think that's where it really ties into what Zack and Dr. Hinderliter were talking about, measuring your blood pressure, because then we can look at over time, is your blood pressure controlled below what we think the best goal is for you, or are you starting to see some over control of blood pressure, where the blood pressure is probably lower than it needs to be. And we oftentimes are able to stop medications, and people are able to lose a significant amount of weight. We are seeing that more and more. And I would say I'm not aware of any long-term changes necessarily that your body wouldn't be able to adapt back after you stop the medication. I mean, if they get very technical, for some medication classes, we may say to take a lower dose for a week and then stop it. But for the most part, we're able to stop most of the medications if we do. Anything you want to add to that? Yeah.
No, it's a great question. I think it does point out the fact that starting medication is not a one-way street. The lifestyle modifications and that sort of things, that medication may not be required in 6 months for blood pressure.
Yeah, I agree. I think the way we monitor for that is really when patients measure blood pressures at home. That gives us an indicator, and oftentimes we say, well, if you're noticing the blood pressure getting below this certain number or threshold, I need you to contact me because that may be the indicator, as you were saying, that we need to back off on your medication. And we're not afraid to do that, you know, like we definitely don't subscribe to this idea that once you start medications, that's it, you know, we're happy to reduce and cut back once those changes have been made.
I love scanning left, right, so you, and then you will be after, right? So, yeah, in the great.
Is heart rate related to blood pressure? If so, like how are those?
I'll give it to the cardiologist here.
They're pretty much separate issues. No, we don't worry so much about heart rate as long as it's in the normal range to really focus more on the blood pressure. There are some blood pressure medicines that can impact your heart rate. So beta blockers, for example, is one that Dr. Deyo mentioned. Some of the calcium blockers will influence heart rate also. So we have to be careful that we don't overdo things, lower your heart rate excessively in pursuit of a lower blood pressure. But they're pretty much independent issues.
For someone with a five-year-old monitor at home, where would one calibrate to make sure the numbers were right?
Yeah, it's a great question. If you have a 5-year-old monitor, how do you get that calibrated? And it's a great point. I'm so appreciative that you asked that question. It is really, really helpful to take your monitor in to your physician's office or healthcare provider's office and compare that with a monitor that's used in the office. Hoping that monitor is accurately well calibrated. Even if you have a validated device, it's still may not be exceedingly accurate in you. These are validated by testing them in a couple hundred patients, and there are going to be some outliers in which that particular monitor is not really accurate. So it's important, even if you have a good monitor, to take it in and make sure that it's really giving you good things. And your physician's office is the best place to do
So like, why does talking while you take your extra results?
Yeah. So the question is, what is talking while you're getting your blood pressure measured affect the results? And so, you know, talking, especially if you're talking about a topic, politics, talking about an upcoming wedding, things that can be stressful, right? You know, emotional, right? So when you're talking about a topic that elicits some emotion, our bodies respond by increasing stress hormones internally, right? That's how kind of stress affects blood pressure, right? We create these stress hormones in our body. These stress hormones then raise blood pressure. So that's how and why we ask, you know, there should be no talking on behalf of whoever's taking your blood pressure as well as whose blood pressure is being obtained, you know, during a blood pressure impairment.
Somebody who's over the age of 90 almost had no blood pressure issues till then. After the age of 90 goes for a visit and the doctor finds that the systolic is slightly elevated and decides to start them on medication. What are your thoughts about it? Should we do?
Without me already. So the question is, if somebody is non-engineering in their 90s, and they all of a sudden develop high blood pressure, been normal tendency throughout their life, but now have high blood pressure, it's just a little high. Should it be lowered with medication? And I think that depends a lot on the patient, not to script the question, but blood pressure tends to go up almost inexorably with age. We can solve that with the lifestyle modifications that Dr. Voora described. But the natural history of blood pressure in all of us is the systolic blood pressure. That's where it continues to climb to the point where, once we're in our 90s, we're in our 90s, 95% of us or so will have hypertension. So it's very common in older folks. We used to think that people my age shouldn't be treated as aggressively with blood pressure lowering medication. At my age, you're frail, have more adverse effects from the medications. We know now that that's not really true. And older folks, 65, 70 and older, I'm one of you. Actually benefit more from blood pressure lowering than younger people in any respect. Now, where you draw the line is another issue. We don't have a lot of data in 90-year-olds. So I don't exactly know the answer to that question. But in my mind, it depends a lot on other characteristics of that patient. Are they already on a lot of drugs? Are we just adding on another one? How much is the blood pressure elevated? How active and healthy is the patient overall? Those are factors that would help me make that decision. One advantage to lowering blood pressure that we haven't talked about tonight, but deserves some mention for folks my age and older, is that treating high blood pressure preserves cognitive function. So it really helps with just to study out recently, demonstrating this again, that if you aggressively treat, and by aggressively I mean shooting for a blood pressure, systolic blood pressure, that means 30 or so, older folks, we will have observe cognitive function, delay the onset of dementia. So at a real blood pressure lowering is a good thing.
Unfortunately, I think we're gonna have to cut off questions there as we're getting pretty close to time here. We still wanted to do a really quick demo to show you guys how we take blood pressure, which I think Zach might be willing to do. Or anyone else put on the spot. That will do a quick demo of that, and then I think we'll go ahead and do our official closeout after that. And then anyone who wants to stay and try taking blood pressure, have your blood pressure taken is welcome to, and then we'll also do this. So we'll do a quick demo. I guess I'll volunteer myself as a game.
So we gotta wait 5 minutes. I can't do it wrong in front of a cardiologist, right? A disaster. Oh no.
Yeah.
Yeah.
Any plans or no sleeves?
Pretty good. So we waited 5 minutes. You're doing a great job. But it's important on these blood pressure monitors. It's so blood pressure cuffs. They say artery. The artery is on the front of not your elbow side, but the anterior front part. And so you want to make sure that this is over there. Then on the blood pressure. So we're going to monitor up here. Yeah, don't cross your legs, all that kind of thing. Okay. I haven't used this exact one before, but I'm looking at the pressure. There's a little knob here for controlling the airflow. So, okay, this is gonna get tight. And I have the stethoscope in, so I can't really hear you too much. So poke me if it's okay. So this is probably above her blood pressure. I'm gonna slowly decrease it. And I hear it start. I just hear a boom. And then I just keep watching it as it slowly goes down. Still here. Going really slow to be accurate. Until you go down, until you don't hear it anymore. So it's kind of strange demonstrating. Right? I can't hear anybody. But anyways, I'll release it my journalist. Sorry. But you just open up, listen right in front of where the blood vessel is blocked off. So you can hear the turbulence every time the heart beats. And you listen for when you hear the sound start and until they go away.
What were her numbers?
I'm not allowed to reveal any chapter. But if anybody else wants to do that, I will stick around here. I guess I'm wearing a shirt, but we'll figure it out anyways.
Yeah, so we have like 10 blood pressure cuffs on over there as well, so plenty for people to practice if you'd like to, as well as some of the automated ones as well. Before we officially close out, I want to thank all of the students who have been involved. So this program is put on by the UNC PhD program. So all the people who helped to run this are current students in our program. So if everyone can kind of stand up or something that you. And also I want to do another round of applause for our speakers. And this year is Ryan Matthews' second or third year, depending on who you ask, running this program. And we really enjoy doing it, but this will be our last year running it. We're going to hand it off to some of the younger people in the program. But it was our pleasure to.
We'll still be involved.
We'll still be around. But that being said, we do want to continue to improve this program. So we'll put the QR code back up, as well as I'll email it out to all of you guys. And we would love to hear some feedback. And if you think that you came to 3 or more sessions in person, you can go over and check with Amber over there, and she has a lovely little certificates for you, as well as we can pull out our swag as well for you to shoot. But anyways, thank you everyone for taking the How was that?